Hello, my name is Annabel and I'll be demonstrating the skill of the NG tube. Dot, dot, dot.
Come in.
Good morning, my name is Annabel and I'm a student nurse from Nevada State College. Can I have you verify your name for me, please?
David Schumer,
And your date of birth?
1/10/63.
Okay, let me check your name, man. Alright, everything seems to be checked. So Dr. Kaufman has ordered the NG tube procedure for you today. Do you know what an NG tube is?
No.
No? Okay. So it's a tube that goes into your nose, all the way down into your stomach, and it helps with helps remove gastric secretions. And may I ask if you have any allergies?
No.
No allergies? Okay. Have you had any past medical history of nasal polyps, inflammation, severe nosebleeds, or any of that?
No.
No? Okay. So I'm going to go ahead and check your nose. So I check each nostril. Okay, so can I have you breathe through one nose? Alright, and then can I have you breathe through the other nose? Okay, so nose is patent. Now I'm going to check the mouth for any lesions or inflammation. None. And then at this moment I would check for gag reflex. And there is a gag reflex. Okay. So at this moment I would put a cloth on my patient. And I would also have beside me a cup of water. And now I'm going to measure the tube from the nose, around the earlobe, and down to the xiphoid process. And right now it measures up to 50. So I'm going to mark it at 50. Okay. At 50. Now I'm going to lubricate the top. And now I'm going to have my patient hyperextend their head. And now, Mr. Schumer, does it matter which nostril I insert it in?
No.
No? Okay, so I'm going to choose the left nostril. I'm going to insert it slowly. Okay, once I feel resistance, I'm going to have my patient flex their head forward toward their chest. I'll give them a sip of water to start swallowing as I insert the tube slowly, gently. Okay. Okay, so on this patient, I can only go up to 35 centimeters. So I'm just going to mark it at the 35 mark. Okay. Now I'm going to auscultate the stomach to make sure. So I would get a syringe and I would pull in 30 cc's of air and I would insert it into my tube and I'd listen to the stomach and I'd listen for air. Okay. And I hear air. So I have verification that the tube is in place. So I'm going to tape it onto his shirt. I'm also going to check his mouth to make sure there's no kinks. And it's not coiled and there's no kinks. Okay. So for initial check, we would have you have an X-ray, Mr. Schumer, which we do have an order for you. And I would also check to make sure the pH is less than 5. And since I did get the okay that everything is in check, I'm going to go ahead and connect it to the suction. So how are you feeling, Mr. Schumer?
Good.
Good? Okay, is there anything else you need from me?
No.
No? Okay. So I'm going to go ahead and document. So here's your call. If you can use it if you need me, okay? Okay. So I'm going to document that I did this on the... procedure. Number 16, French, NG tube inserted, and left nearest at 35 centimeters, patient toleration. And I would initial, and I'm going to cross out to make sure there's no other person assigned. Okay, so now I have a new order for my patient to have the removal of the NG tube, so now I'm going to demonstrate that.
Come in.
Hello, I'm Annabel, I'm a student nurse from Nevada State College. Can I have you verify your name for me, please? Yeah.
David Schumer,
And your date of birth?
11063.
Okay, and that matches. So today we're going to be removing your NG tube today. How are you feeling?
Good.
Good? Okay. So I'm going to go ahead and disconnect the tube from the suction. I'm going to clamp it so nothing comes out. I'm going to check the skin, and the skin is still intact. I'm going to place another bib on my patient, move the tape. And the tube is still in place at the 35 centimeter mark. So Mr. Schumer, I'm going to have you take a deep breath and hold it when I release it, okay?
Okay.
3, 2, 1. Okay, good job. So now I'm going to go and discard my NG tube in the trash. How are you feeling, Mr. Schumer?
Good.
Good? Okay, so here's mouthwash for your oral hygiene, and then here are also tissues to help wipe any secretions that came out. So is there anything else you need from me?
No.
No? Okay, so if you do need anything else, here's your call light, and make sure you use it if you need me, okay? Go ahead and document my findings, alright?
Okay.
Okay. Wash my hands. So on 10, 8:15. Patient understood and agreed to distribution of NG tube. Number 16 FR NG tube still intact and left nearest at 35 centimeters, patient tolerated. Okay, and then I would also initial, and then I would make sure no extra lines are available so no one else can sign it. And that completes our procedure.